Hi, my name is Dr. Fred Sylvester from New Hanover Chiropractic, and again, welcome to this episode of Health Talk. Again, we're condition specific today, and Dr. Dave Mazzola is with us. He's been with us for almost 10, 13 years, right?
12 in August, yeah.
So, Dave has joined us in practice from a college out of Florida, and he joined our practice back in 2013. He's been an establishment and a rock solid professional, not only in our clinic, but also as he's making some ventures out into the community, helping coaching at Boyertown and all that type of stuff. So a tremendous asset to our practice, and Dave is going to talk to us about low back pain, specifically SI joint pain.
Yes.
Dave, no further ado, here you go.
So I always ask patients, and what you always hear a lot is, hey, I have lower back pain that radiates into the buttocks, the groin, or the hamstring. Most common term you hear out of people's mouth would be what? Oh, is this my sciatic nerve flaring up, right?
Yeah, for sure.
Very commonly misconstrued with SI joint dysfunction, which is what we're going to be discussing a little bit today. What I wanted to do is give people a little bit of a lay of the land of the anatomy of that area, okay? What the SI joint is where your sacrum, which is triangular bone here that runs into your tailbone, meets your ilium, or what we call pelvis here, right here. That is your sacroiliac joint. Sacroiliac joint is a very, very important structure when it comes to your lower back. It deals with distributing all the weight from the upper body to the lower body.
Okay.
Also very critical in stabilizing your back with movements such as walking.
Sure.
Now, quite a few conditions can cause instability or pain in this area. One of the first things that we notice is there could be hypermobility of the SI joint. Around this area is located a lot of ligaments, structures that actually help stabilize. Hypermobility meaning these ligaments, muscles in this area are either weak, which is allowing this joint to move around too much. There also could be hypomobility, where the joint is not actually moving enough. This could be due to structural changes, whether it be arthritis in the area, as well as tight muscles in the lower back, in the hip and pelvis that are restricting this kind of motion. Typically, SI joint dysfunction is caused by prolonged times of sitting, standing, and laying. We're seeing that a lot in today's world. The work dynamic has changed. A lot more people are sitting at home.
More stagnant.
Correct, yes. Working from home, not having the same type of workstation ergonomics as they would in the office as they do at home.
Sure.
This is starting to become more of a condition that is on the rise. Like I said, being very misconstrued with sciatic symptoms. So what I'd like to do is go through some of the treatments that we typically...
Real quick, what's the difference between like an SI joint pain pattern and what sciatic is? Because, if we're going to say that they're not the same, how does the patient present?
Makes it different. Like I said, typically what we see and what I've seen throughout the years with a lot of SI joint is there's actually specific orthopedic tests that will actually, increase a minute of discomfort to that area to validate if there's SI joint dysfunction. But typically what people experience with more SI joint dysfunction is pain that doesn't really radiate past the knee.
Yeah, so
typically what I see a lot of times is pain that's radiating more into the groin. Like, hey, my groin hurts. Or, hey, I'm getting pain that travels right over that bone in the back into the buttocks. I don't know what it is. But one of the biggest differentiating factors, like you just said there, is pain that goes past the knee. Typically past the knee, we're looking at more sciatic symptoms, more irritation into the lumbar spine.
Gotcha.
Okay? So just so you understand how we treat things here at this office, I'll break down into hypermobility conditions versus hypomobility, and then what we'll actually do is show you some little at-home exercise that you can try to do to see if that actually alleviates some of your symptoms. So in hypermobility conditions, right, this is where the joint is moving around too much. You see this a lot with dancers, gymnasts, have a lot of flexibility in that area. What we typically want to do is we want to increase strengthening, core strengthening, right?
Sure.
Create strength to the adductors, which would be your groin muscles, abductors, those areas there. Glutes as well. Now, when we're in more to a hypermobility, type of situation,
not moving enough.
Not moving enough, right? Things are stiff, things are tight. This is where, we come into play with the adjustment, right? We want to actually create more motion, like you were speaking in previous episodes. More movement increases mobility, decreases pain, allows with healing, right? But that's not the only solution to this problem, is we have to start changing the structures around, right? So we need to get into hamstrings. We need to get into psoas muscles. We have to get into some of these other muscles that may be tight that are restricting this area from moving the correct way.
Sure.
Makes sense. There's also a bunch of passive modalities that we can do here at our office to help control pain, right? We can do STIM, also known as TENS unit. icing, we have laser now. Obviously, you know, KT taping is a very valuable tool as well that was used a lot here at this office. The nice thing with the KT tape is there's multiple different ways to tape to get symptomatic relief dependent on the condition. So for a hypermobility, you know, type of condition, there's different ways we can tape to stabilize that area. If there's more hypertension in the muscles causing hypomobility, there's some taping we can do to actually release those tissues in that lower back. So what I'd like to do is kind of give a demonstration to, you know, the viewers at home on, hey, if I have more of a hypermobility or type of condition, what types of stretches that I can do at home to help alleviate? So this is one of the first stretches that a lot of patients can try to do at home. Little tricky, you need to be in a situation where you're on an elevated surface. Typically, I try to tell patients you want to be on the bed. You have to watch, you see how Dr. Sylvester has to be a little bit shaded to the side. You don't want to lose your balance to fall off the bed. Now, in extreme circumstances where patients are very tight, unlike Dr. Sylvester here, sometimes you do not even need a stretch strap to assist. With gravity being in play, you are able to just let this leg hang and open up. Now, doing this stretch correctly, Dr. Sylvester, you should probably feel a little bit into the thigh.
I can definitely feel. Yep.
We're trying to isolate a little bit higher into your psoas, which is your hip flexor, okay? Now, if you heard in previous episodes, when we do stretching, we always recommend 2 sets of about a 20-second hold. So what you want to do is you want to find the tension point. It should be uncomfortable, but not painful. If it is painful, it means you're pushing too hard, and you can overstretch the area. So you want to feel a slightly uncomfortable stretch that area, hold for 20 seconds, and then reset.
And I also know, Dave, if you want to intensify the stretch, just drop this leg out.
Correct.
And
Correct.
as you go ahead straight up through here, that definitely will give you a higher, more effective stretch. But you may not be able to do that at the very beginning.
Yes, you may have to modify. Even adding the stretch strap may be something you may have to add into later.
For sure.
If you do not have a stretch strap, you can, you know, use a dog leash. You can use a belt. You just want something where you can loop it around the toe to actually gain some access to have a lever to pull. Now, make sure when you do these stretches, I tell all my patients, you want to be doing them bilaterally. Okay? You don't want to overstretch one side and not the other. That can create more imbalance and instability. Okay? One of the next stretches that you can do that is very easy would be hamstring stretch. Now, as Dr. Sylvester stated, you want to make this exercise more challenging, drop this leg. But I would say in the beginning, you want to keep this leg bent. What the biggest key with the hamstring is what a lot of people do is they start to feel the stretch. Common theme is boom, bend the knee. The minute you bend the knee, you're taking slack out of the hamstring. The height of the leg means nothing when it comes to doing the stretch. It's about how far can I keep my leg up with the knee locked. So when you bring your leg up, you want to keep this knee locked. You want the stretch strap around the arch of the foot towards the ball of the foot so you can isolate into the hamstring. Once again, you're going to do that 2 times for about 20-second hold, and then you would also flip and do the other side. The next stretch is going to be for the glute piriformis area. So this one, multiple ways to do it. There is the one out of bed, and there's one actually seated. So since you're seated, we could actually do this one together. Seated, if you want to stretch the right side, the right leg needs to be crossed. Now, depending on how tight you are, this may be enough to stretch that posterior glute. What you're aiming for is the back area of the buttocks there. If you need to increase tension to get that stretch to be more effective, please place your leg across. So you want to push across, and then I always say pull in. Once again, 2 repetitions, 20-second hold.
Perfect.
If you want to do it the other way, you just flip. Obviously, make sure you always go across first to lengthen, and then pull in to shorten.
Chin up, chest up.
Correct.
Yep.
Those are very easy exercises that are able to be done at home. If symptoms persist, we recommend calling because you could have more of the other situation where the area is more hypermobile, where we may need to do more extensive rehab to that area.
My grandma always used to say this, 1 week coming, 1 week going. If it's not gone by then, you should get somebody to look at it, right?
I agree.
And so that's where we're at today with the SI joint and a little bit of the hamstring and stuff. So good day and good health.